Thank you so much, Madam Chairman. I really appreciate it. Mr. Secretary, you've said by helping rural hospitals stay open, we are helping residents of rural areas get the care they need close to home. Having access to care nearby is not only more convenient, but it also lends to better health outcomes and boost local economies. I want to say I couldn't agree with you more. I certainly hope that you mean that, and I assume that you would confirm that you do.
Yeah, and any ideas you have, because there are a lot of healthcare facilities in rural America that are on the verge of closing.
Yeah.
Once they close, it's tough to reopen, so we're more than willing to work with any of you who are interested in that.
That is wonderful, because that's actually the commitment I want from you today. We, as you know, there are a very small number of new rural hospitals that opened in 2020 just before the country shut down, and one of these hospitals is actually located in Alabama. So Thomasville Regional Medical Center was among the unfortunate few who were deemed ineligible for provider relief funds due to the formula's reliance on the figures from 2019, and you're well aware of this, as you know.
Yeah.
Throughout your tenure, many of my colleagues, Representative Sewell there on the other side, in the other chamber, and on the other side of the aisle, has talked to you about this and has asked for your commitment in budget hearings just like this, and received it, to working with us to find solutions for this group of needy hospitals. These members received a commitment from you and their offices to ensure that these hospitals received proper federal assistance via the Provider Relief Fund. And so my assumption is that you stand by that testimony. And my question would be, what actions did you take to ensure Thomasville Regional Medical Center received adequate provider relief funds?
Thomasville, like many of the facilities that have applied, have to meet the criteria that Congress set forth for us to be able to fund them with the provider relief dollars that were made available. Where we had some flexibilities, some discretion, we took them to try to help some of the facilities that were clearly hurting and in desperate need, especially those that were providing services to folks who are in underserved areas. But our discretion, our flexibility is limited by what Congress set forth as the guidelines for distributing the dollars. Too many facilities, and I suspect Thomasville being one of them, fell within that scope where it became difficult to reach them because of the criteria.
So what do we do? I mean, because there has to be a pathway to help, because just as you mentioned, they are on the verge of closing. And if you look at some of the things that we've seen, they have kind of, the Harvard School of Public Health put out that this congressional district has the lowest life expectancy in the country. And so if we are not going to help hospitals like this that provide people access to care within their communities, your very first statement that I wholeheartedly agree with, then what are we doing? I mean, this is what we're here for. So you're telling me why we can't. Tell me how we can. That's what I want to know.
Yeah, and we can if you all hadn't swept up close to $5 billion that we had in COVID relief dollars, we could have perhaps come to you and asked for you for more flexibility to use some of that money for some of those providers under the Provider Relief Fund. We're out of money in the Provider Relief Fund.
So there was about $7 billion left, right? Is that right?
At this stage, no.
But when that occurred?
Left in the sense that it had not yet been obligated, but it was already destined to go to provide different services. It was then swept up by Congress, and now it's no longer available.
So what can we do?
Well, you can always try to re-up the provider relief.
Well, no, I mean, what can you do in your role right now? What can you commit to me to help keep this hospital open? Or what resources are available? What thought process do you have? You obviously sit in the big chair, so don't tell me what you don't have. Tell me what you do have and how we can get that to a path of success.
Well, the problem is if I don't have the resources to make things happen, there's only so much I can tell them we can do, because what they want is money. They're not interested in smiles. They're interested in money. If I don't have money in my pocket, you all swept it up. It makes it tough for me to offer.
Do you have any money that could work to go towards that at all?
Senator, as you know how the way things work, you tell me where I can spend the money.
Okay, so what would I need to advocate for right here in this budget to help move that forward?
There's two things you can do. Pass legislation that gives us more flexibility in using some of the money you've already given us, which probably would gain some opposition from folks who say, wait a minute, that's already money that we're going to use and you're sending it off to somebody else, so you're going to have to deal with that. But you could do that, give us more flexibility with money we do have, which we don't have flexibility to use, for example, with a program like Thomasville. Or you can re-up a program like the Provider Relief Fund that has some resources so that when Thomasville comes to us, I can say, we now have some resources that we can provide to you.
Will you commit to continuing this conversation with me, the two of us?
Absolutely.
Thank you.